right. Good evening, everyone. Welcome back to Pump Up the Volume, where we're amplifying the voices of communities and bringing you real stories as to what's going on in this current pandemic and another, obviously, crises that we've confronted over the past several months, including social as well as economic. So here we are. My name is Daniel Munoz. I'm a medical doctor, previous independent gubernatorial candidate here in the state of Rhode Island. And I am joined by my fellow co-host, who also have amazing stories and journeys, Mr. Bill Bartholomew from the Bartholomew Town podcast. Joining us, we have Mr. Pat Ford, founder of the Libertarian Party here in the state of Rhode Island and founder of the Coalition Radio Network, which we're actually streaming through, as well as Mr. Scott Rotondo from WBOB 990, as always, bringing real stories from the city of Pawtucket. And so here we are, all of us, once again, bringing you news of COVID-19, right? I mean, because that is not only the latest topic, but it is the one that is impacting our lives, given that we are on about a 2-week stay-at-home order. I wouldn't call it really a lockdown if you look at other states and countries, but I guess it's the best that Rhode Island got for us. So with that, we're going to do as we always do. We're going to start off with Bill. Bill's going to lead the way, give us some updates that he's learned about over the past week, and then we're going to tackle an important question today, but I don't want to overshadow the great news and the updates that Bill's going to share. So we'll leave the question for after. All right, Bill?
Wow. Well, look, I mean, you touched on it. I mean, here we are in this pause, and they're calling it a pause, but it's a lot of asterisks involved in this, right? Restaurants are still at 33% capacity indoor dining. Just today, there was sort of a gaping hole exposed in which I received a question from a listener that said he was going through immunotherapy and part of his regimen was working out at a gym with a trainer. And, are you not hearing me? Hold on a second.
Nope, I hear you fine.
I hear you.
Okay. Yeah. Okay. Sorry. Yeah, I got a message in the chat. There we go. Part of his regimen was working out in a gym with a trainer. So I wrote the Department of Health and asked, hey, if someone has quote unquote prescription to work out, can they work out in a gym? And, basically what happened was the health department said, yeah, today they told me anybody who is going to a gym for a therapeutic reason, well, they're entitled to use a gym. So that exposes a gaping hole in which the administration is willing to say, hey, look, we understand that there's going to be a lawsuits left and right if we actually were to go to a full scale lockdown. So I think that's why we're in this pause. I think everybody knows the right thing to do would be to pay people to stay home, pay businesses to get through, and print additional currency, poach from other, projects like in the military, industrial, aerospace sector, whatever it may be, to bridge this period. But obviously that's not going to happen. It's been exposed. We live in a corporatocracy, and that's what this pause is all about. And right now, the question is, as we see hospitalizations increase, we see the field hospitals opening today, admitting their first few patients. The question is, at what point do the people, by and large, realize that they're in a dangerous situation and do what's right for them, which would be to be in small groups, wear a mask, all the things that we've been talking about, but do it because they know that's what's right versus what's coming from the podium every Thursday now at 1:00. So that's where we're at this week. It's not getting better. The pause, it'll be interesting to see how many months this goes on for. It's certainly not going to be 2 weeks.
Yeah, thanks for sharing, Bill. You're absolutely right. It's not going to be for 2 weeks. And, it's interesting. You have this, you have the president-elect talking about, alleviating student debt by about $10,000 per person when we don't even have a stimulus check cleared for the many families that need just $1,200 to make it through the winter. So the platitudes and empty promises continue. And so what is the question that we should be facing today? And it's one that I've been thinking about, given that we have the field hospitals that have been built up again. We have patients that are ending up at the field hospitals. And just to put it out there, this is not a matter of just COVID-19 positive patients ending up in the hospital. There are patients in the hospital for many other reasons. But with those patients in the hospital, there is a minimal amount of space that COVID-19 patients would have, whether it's an ICU or a main floor for medicine, right? So without that space, they end up in field hospitals. And as we know, for historical from history, when you end up in a field hospital that does not have the quality in infrastructure built out, right? Because it's just been lifted up in a tent or in an empty space over the course of 1 week, the quality of healthcare is going to vary. And when I say vary, I mean it's going to be less than good than in the hospital. And so here's the question. We know people are ending up in field hospitals, but the challenge we're going to be faced with is, even if we have a bed, do we have enough medicine? Do we have enough equipment? Yes, ventilators is one type of equipment, but there's much more in the way of medical supplies that's needed to care for someone, especially someone who may need help breathing, someone who may have undergone some type of coagulation in their blood system as a result of some type of infection, right? These patients, it's not simple. COVID-19 isn't coming with just a breathing problem. We're seeing systemic issues within, systematic or physiologic issues or effects of this disease. And so here's the question. What would crisis criteria look like, given that this administration, early on in the pandemic, failed to have an equitable response in terms of how they were taking care of communities that have been disproportionately impacted by COVID-19, communities like Providence, communities like Central Falls, communities like Pawtucket. And we are now seeing, again, communities like North Providence being heavily impacted, as we started to see towards the later part of the spring. So it's not to disregard, right, the fact that we have towns and cities across the state that are being impacted by COVID-19, but as evidence of a disconnect in this administration's ability to have an equity lens and saying, how do we allocate resources to help those in greatest need? The fact that they failed to do that in the spring. What does a crisis criteria look like in the winter? And so a crisis criteria would be, let me put this in perspective for everyone who's listening to us for the first time and hasn't been with us for the past few weeks. Crisis criteria would be the criteria that takes effect if and when health systems are required to ration care. If there is not enough in the way of specific medical resources, supplies, beds, otherwise, that we can give where we can give something to everyone to take care of them, then hard decisions will be made where someone may have a bed, but they may not have the vent. They may not have a bed. They may not have the vent, and therefore they have to stay at home. That is the crisis criteria. That is how the crisis criteria is applied. The question is, how does that crisis criteria look? What are we saying we're going to use to make those decisions? Is it age? Is it the amount of diseases that someone has? Is it a combination of both? We saw in New York City, and I'm going to hand this off to my co-host right now, but I just want to point out, we saw in New York City that there were people dying at home. And at that time, the filtering system wasn't a crisis criteria. The filtering system was testing back then. In other words, people were being told that unless they had severe symptoms, they couldn't get a test. If you couldn't get a test and you couldn't get diagnosed as being positive, then you did not receive care, right? So that was the bottleneck. And so people were at home sick and they died at home. Until this day, probably some of those families don't have a confirmed diagnosis of COVID-19, given the death at home. And so crisis criteria, right? The bottleneck for testing no longer exists because we fought as a community to get more testing. And so we're seeing more testing. We're seeing close to 10% positivity throughout the state of Rhode Island, which is, a beacon of red on a map when you look at northeastern states. And so moving forward, to be clear, we don't have a bottleneck for testing anymore. We clearly see positive cases, but if this crisis criteria is implemented, how does it look given this administration's history? So I hope that was clear. And with that, I'm going to hand it off. Why don't we start with Pat? We'll go to Bill, and then we'll go to Scott after.
Gee, thanks. You're swell. Hey, all right. So there's two ways you can look at it from the perspective of the administration as it's been based on past behavior. And then, of course, there's the way it probably should be. If you base it on the administration's past behavior, you would need to have produced evidence that you made a donation to the Rotondo. I'm sorry. Was that cynical? Yeah, I think the administration is smart enough to know that the people who are first responders need to be up at the front of that. People who are in a position where and this is where it gets ugly. Just lay it out here. I would bet that the administration, based on how they approached the financial triage that's taken place if you will, if I could dignify it with that term in the business community, will look to people who actually have a chance at recovery, who will be adjudicated, if you will, and I use that term intentionally, by the medical community as someone who is actually got a chance to survive it. Hard choices will be made with people with comorbidities. Hard choices will be made, and of course, hard choice is we've got a lot. First of all, I just want to make one quick point. We've got far too many euphemisms in Rhode Island government today. The two that need to go away is hard choices, because you're going to be soon picking people who are either going to live or die. And then I'm blanking a little bit, but the one that we apply to food insecurity. Thank you. George Carlin would have a field day in Rhode Island if you're old enough to understand that reference. But can we just call for what it is? 1 in 4 Rhode Islanders are suffering from some level of basic malnutrition. So my bet is that the direction they go in is the survivability rate.
Thanks, Pat. Thanks for sharing.
Yeah, I think that's probably right. I mean, right now, just today, they're announcing, I think it's in the plus 70% range of deaths here in Rhode Island have occurred to folks who are 70 plus years old. So, that is what they're going to bank on for sure. But, when it comes to rationing care, it's just one of those topics that it reminds you of just how incomplete our medical system is, and our healthcare system for that rather. And it just makes me sick. My opinion is my politics have changed so much in COVID. You know what I mean? For even being pretty open about who I was beforehand, these types of questions are the ones that make you say, well, we need to rebuild so much of what we have here. However we do it, it can be from a variety of opinions, because I know we've talked about single payer versus other systems on this show, and there's pros and cons, and I don't think that there's a single solution right now that's been presented that would work. But what we do know is that we have to rebuild this thing from a brick and mortar standpoint all the way up through the crisis management standpoint. And it's just sad. I can't even really broadcast on it without just, thinking this is a sad situation that we're supposedly so far advanced as a species and as a nation. Yet here we are with people potentially dying on the floor of the Dunkin' Donuts Center or the Rhode Island Convention Center, or whatever it is, hopefully not, but possibly staring at billboard signs as the last thing that they see before they perish from this vicious plague.
Thanks, Bill. Scott?
Yeah, just to echo what Bill said, I mean, the fact that we're the most advanced nation in history, supposedly, and the richest nation, and that we're talking about rationing care in this situation is just it's offensive, which I know is a word that's overused, and yeah, just definitely disgusting. In terms of crisis criteria that the administration would use to ration such care, I'm not even going to venture an answer, and here's why. And I talked about this with you, Dr. Munoz, on my show last night. Gina Raimondo and any chief executive of the state has what I'd call a fiduciary responsibility. So in my job as a controller for my company, I have a fiduciary responsibility to the company, which means I have to make hard decisions, even if they lead to my termination, to protect the company as a whole. And that's what Gina has as well, as the leader of Rhode Island. And I feel like with this stop and start, this pause, but not really, this shutdown, but we'll leave Twin Rivers open as long as possible to get some money into the coffers. I really don't see what direction she's going. It may be indeed who can survive more. It may be, I mean, who knows? It's almost like throwing darts at a dartboard right now. So I wish I had a more concise answer as to what her crisis criteria would be. But unfortunately, I'm not even going to venture a guess to that right now.
Thanks, Scott. This brings me back to the spring, and Bill, you might remember we did a short segment on this on your show, which was the study in the UK, right? Black men with COVID-19, and it showed that Black men and let's see with the UK for what it is, right? I mean, it's an extension of Western civilization, right? So when you talk about systemic racism, when you talk all of these things that are coming up in our country, that country is facing it. While there's some differences, obviously, in government structure overall, like I just want to qualify the study that what it showed is something that we should think about heavily here in the United States and given our current situation. It showed that Black men were four times as likely to die of COVID-19, or the risk of death for COVID-19 was 4 times higher than other non-Black men, right? Races. And so what did that say? Well, they wanted to know, like, well, we know that Black men, in terms of demographics, there's more high blood pressure, prevalence of more high blood pressure in terms of specific chronic disease. And so they removed all the comorbidities. So in statistics, you can try to normalize, right, the data. You can say, well, what if we took these factors out of the equation? What if we put the comorbidities, the sicknesses aside? What if we put the age aside? What if we put the economic level that they fall in aside, right? So we take poverty out of the equation, we take sickness out of the equation, we even take age out of the equation. Is there still a difference? And they found that yes, there was Black men were still 2 times, the risk of death was 2 times greater for Black men compared to non-Black men. And so when I think of a crisis criteria, my concern is that we see in the data, we see in clinical data that Black men are more likely to die of COVID-19, even when you remove all other factors, which means that there's something there. Is it the quality of care, right? Is it something just profoundly within the kind of environment and culture that we've created that communities are afraid to go to the hospital because they don't think that they're going to get the care that they need? We also see that there are poor outcomes for women of color in healthcare, right? So there's evidence to show that there is something going on that leads to poor outcomes in people of color. And we have communities that are disproportionately impacted, which are predominantly communities of color here in the state of Rhode Island. So the easy step in any crisis criteria might be age. It makes it simple because for the most part, even in the spring, we saw the simplicity of that. We saw that nursing homes were pretty much disregarded by administrations across states, across the United States, right? Where they were sending people back in New York City to the nursing homes, sending them back before even understanding whether they were completely clear. And so we saw the use of age as a way of, either treating people or completely just housing them in a building and removing them. We saw it in Italy with age as well. But when the hospital beds are taken up and age is no longer a factor, right? When we've taken every measure to keep our nursing homes safe, and now when we're seeing an increase in positivity rates for 30 to 59-year-olds, and those individuals have comorbidities, there's diabetes, there's heart disease, there's other chronic diseases, what do we then do? What's the second component of crisis criteria? Because the moment we get to, if we were to get to, and I hope we don't, but if we start to have to decide how many diseases someone has, the age related to the disease, if they're middle-aged and have 2 diseases or 3 diseases, that's when it really becomes an equity issue. That's when we start to see a difference in communities that have been suffering under poverty, have had to, poor nutrition, right? And malnutrition and poor nutrition go hand in hand sometimes. People, if they don't have options to eat healthy, they'll just eat what they can get. And as a consequence of that, you see diabetes. As a consequence, you see high blood pressure. And so if we were to have to take that second step, I just don't see another way. Right? I don't see another way that this administration could take a step. And the moment we get there is the moment that we just fail. We fail. So please tell me I'm wrong, guys. Please tell me that you're thinking about a second step that I've missed here.
No, you're not wrong. And to your point, we live in a society where people chase calories, if you will. And when I mean that, I'm talking about in terms of being able to simply function for folks, communities that are marginalized, as opposed to, what's the old line? Eat to live, not live to eat. There's that. There are so many fundamental problems that are destroying, if you will, whatever is left of a foundation for the society in Rhode Island, that, frankly, I'm not optimistic. What do you guys think?
It's hard to be optimistic right now, except for, what motivates me are the people that have ideas particularly in the younger demographic right now, people who are, not only in the younger demographic, but there's, I see ideas that are radical, quote unquote, that can kind of help to rebuild things and take into account the many perspectives that are kind of left out of the status quo. But it is true. I think I kind of was deflated significantly after the press conference 2 weeks ago with the governor when she literally said the words Black Friday several times in her announcement. And I still haven't really come back from that, realization that, oh yeah, no matter what, at the end of the day, the notion that we've gotten into I used to think we were in runaway capitalism. Okay. We were in a situation where our infrastructure, our system of government was broken in the sense that it had betrayed what pure capitalism should be. Now I'm starting to think, actually, that's not true. This is what pure capitalism looks like playing itself out. These are the holes that are exposed by that system, because yes, it's rigged. Yes, it's a corporatocracy, but at the end of the day, we may need to move into a completely new way of thinking. I'm not sure what that is, but that's where I'm at right now, is that there's no way out if we pursue our society in the current structure.
I'm going to let Scott. It's Scott's turn, but I'm going to reserve the right to turn into I wouldn't say a hostile witness, but a debatable witness on that point. But Scott?
Oh, that sounds good to me, Pat. Yeah, because I was going to say to Bill's point, I think it's more, and I'm going to borrow something that Pat Ford has said more than once. It's more crony capitalism as opposed to just unchecked pure capitalism. I mean, you can definitely see the favoritism and the nepotism in government right now. I mean, leaving Twin Rivers open until just about the last minute because they fill the state coffers. Doing everything they can to just put a pile driver on the small businesses, the mom and pop stores that I feel contribute a hell of a lot more to every community than the big box stores. I would call it more crony capitalism at this point. That's not really what pure capitalism is supposed to be. So that's just my 2 cents there.
See, capitalism is the mechanism by which the individual can reach their full potential. But based on, that implicit in that context is the notion that government will not create barriers to entry for the execution of free and open markets. And healthcare, clearly, as I've mentioned before, is one of those. As I drive around and, every day I gather my few belongings and I travel north to Massachusetts to do the work that people from Massachusetts won't do, I notice a plethora, if you will, of privately owned, private financed healthcare centers, which all have to compete against each other based in part on a price point and based in part on facilities and based in part on performance. That's the way capitalism is supposed to work. In Rhode Island, we've got a shortage of healthcare facilities. Why? Because Rhode Island government has placed barriers to entry for people to come into the medical space on a private basis and execute the business plan that they choose. That's a perfect example of crony capitalism. In order to protect the two big hospitals organizations in the state, there will be no competition, and as a result, people have died, people have suffered needlessly. So, if to describe capitalism properly, one has to allow markets to work. And in this country, it's been a very long time since markets have been allowed to work.
Yeah, and I guess the only way that you could reset it. Oh, go ahead, Doctor.
No, you can go, but I'll go after.
I think the only way that you can reset it is to start from scratch. So the fundamental, there's an element of capitalism, survival of the fittest, right? And unless you wipe things, so the folks who are behind Twin River, the folks who are behind the hospital corporations here in the state, they have perhaps an unfair advantage, but they have all ended up in a particular situation to gain that advantage. Maybe it's because of inherent privilege when they were born. Maybe it's because they worked hard and got a degree, and maybe it's because they, went to the right bars after their shifts in a middle management role and kind of worked their way up the system. Whatever it is, it's the nature of the beast is survival of the fittest, and perhaps the nature of that would then leave a lot of people behind. And so that's where I'm at now, is that, okay, again, I'm not saying we need to abandon. I'm not sure. I haven't come to a personal conclusion, but I will say for the first time I have thought, yeah, it's crony capitalism, but is capitalism in and of itself intended for cronyism of one way or another? Is the free market ever really going to be truly free, given the fact that not everyone is a benevolent person? And if you're trying to survive in the fittest manner for yourself, why wouldn't you undercut others in society?
Well, if I could just respond to that, the problem is not the individuals. The problem is how we, as a government, the government that we've elected, manages corporate behavior. And in the case of the hospital, this could be fixed very easily. In case of Twin River, simply allow all businesses to be able to pursue gambling activities if they so choose. They don't have to, but if they like to, they can. All of a sudden, you've got free market competition. People have to, again, perform based on their skills, their merit, their work, their preparation, all the things that are supposed to be. Now, understand, when people fail in the free market, and the free market ultimately is designed to create failure, if you will, or should I say foster failure, because ultimately, if there are no government protections in place, people will fail at businesses. However, opportunities will open up right away for those people who have an entrepreneurial bent. And in fact, most of the successful entrepreneurs that you'll meet at just about every level have in fact failed at businesses before they ultimately were successful. In the case of some Rhode Island businesses, they were successful, and then they tried a couple other things and then they failed. That's the nature of the free market. It is not to guarantee success to anyone, but it is to allow everyone the opportunity through a fair and open marketplace to shoot for that success. Failure
I think the issue. Sorry, Pat.
I was just going to say, failure is a critical component of the free market. Some must fail, and when we don't allow failure to take place, you have banks that are too big to fail. You've got a student loan crisis that is too big to fail. You've got a healthcare. Listen, and by the way, in healthcare, simply eliminate the statutory requirement for certificates of needs. That's it. Do that. And all of a sudden, you'll see opportunities open up because people with capital will invest in facilities that will seek to compete with established players and not have to kowtow to a bureaucratic system that's been rigged in favor of a handful of large corporations.
Yeah, but we have to be careful because corporate gaming can actually impact lives when the lights are going out and people are on beds. So I just want to put that in perspective. You know, healthcare does have a socialistic element in that if someone's sick and dying on the floor, you bring them in the ER. If they don't have money, you still take care of them. So we have to be a profit. You know, profit does. I mean, it may drive the hospital's administrators, but not the physicians that are in the hospital. You know, we take a Hippocratic oath to care for everyone. So I just want to put that in perspective. Like, and you know, I always try to have a balanced perspective, Pat, here. Yeah. And I also want to point out that if we're going to take this discussion and we're going to apply it to this crisis, then I would say the word that we need to focus on is participation, right? There have been gains made, economic gains made during this crisis, and health consumers have not been allowed to participate in those gains. So when we go to CVS and get a rapid test, that's being used for data that's going to become profit, okay? And so if we're going to start, you want to talk how to bring technology in, how to profit share, and also incentivize people to stay at home and follow the rules. Well, you pretty much, you know, remove the online sales tax for the entire crisis so people shop at home. You attach your mobile app to essentially discounts that essentially show that you're at home. And so as long as you're at home and you're purchasing from home, you get those discounts. You essentially, if you go to CVS and get a test, you actually get $5 to take the test because CVS is going to make $20 off that data point, right? There are ways and things that could have been negotiated by this administration when deals were made with CVS and they weren't done. Now, that may seem like only an economic gain and, you know, again, participation. I'm all for capitalism as long as everyone can participate and has an equal access to it. But we weren't allowed. We haven't been allowed. And so in terms of healthcare and the implication that idea has on healthcare is that, you know, people were going to pay the same sales tax whether they're indoors or outdoors. So what you weigh experience more than not having the experience. So you go outdoors. You know, you're at home and you have an app that's talking to you or flagging you to be isolated and quarantined, but that very app is not connecting a food delivery service that not only will get the food to you in a reliable amount of time, but also just pretty much you'll get the food paid for by the state, right? Like we've had opportunities to give money, which is not really giving, it's really just recycling it, because the very people that are spending it are the ones that need it back and are going to spend it again. And we're failing to do that. So I don't think that's socialistic. And in this crisis, I think it's the best form of capitalism. And we haven't used any methodology or tool that resembles what I've just said right there.
The challenge being, though, that, for example, with your idea about waiving sales tax, first of all, that lends itself to an online presence, which lends itself again to inadvertently, I don't think intentionally, but inadvertently, the support of the big box organizations. Where we're crucified as a state is because our economy is so thoroughly unbalanced because of generations of interference that the people taking the biggest dive and disproportionately impacting and creating this rolling wave of pain across the state because they trigger unemployment, which then again engages in that same vicious cycle where now you have people who are food insecure and you have people who are underemployed or unemployed, is finding ways simply to allow businesses to make their own decisions, to tailor solutions to the crisis. And a perfect example of that is the decision early on. And Scott, I'll put you on the spot and I'll ask you your reaction to this. I mean, one of the first things the state did in behalf of the restaurants was roll back the laws about selling booze to go. And all of a sudden, we woke up to the fact that businesses were being responsible about how they did it, and that by selling booze to go, you took out a barrier implemented by the state, and restaurants were able to, God forbid, make money, which by then, of course, meant that they were able to keep their staff. The restaurateurs that I know were and still are desperate to find ways to hold together their teams. I have a good friend who's a caterer. He's been on this show, and he has carefully assembled a team, a literal team of all sorts of talents over a 10-plus year process, and that is what is impacting him the most, the inability to maintain that team. That's a sort of intellectual capital that he's developed through hard work and time and effort and all that good stuff. So, again, government's micromanagement, as well-intentioned as I'll, for the time being, say it was, is at the essence not of the creation of the crisis, but our inability to respond to the crisis. It's that simple.
Yeah, I'll definitely echo what you said, Pat. As far as especially the booze to go, there's the fact is it shouldn't have even been a restriction in the first place. As we're seeing, restaurants and businesses being, responsible about it. To me, it was basically the government giving us some crutches after breaking our leg, if you will, if you want to use that analogy for those restaurants. And you're right. I mean, it's like they act like they're giving some sort of a big favor when they're putting all these restrictions. And I understand there need to be restrictions in place right now, but it's like they're only getting off these restaurants' throats because they're worried about the massive unemployment that we're going to see after this pandemic ends. It'll be curious to me to see post-pandemic if they go back and kind of roll back some of these rollbacks that they've done. For instance, with the selling booze to go, it'll be interesting to see if they take that back.
But when we talk about reinvention here, and we're at about time for today, so we'll probably have this last portion, and then everyone can lift up what's going to happen over the next week on their respective channels. But when we talk about like radical change and what that means, everyone on this show knows I love ideas, but practical implementation, right? How does that in an operational light, like how does that look? What's the infrastructure? And if you can't speak to that, then it's just an idea, which is great. We all have them over a beer. But when we talk about reinvention, radical change in this environment, one thing that's pretty clear to me is that Rhode Island had an opportunity for years. Frankly, that opportunity I mean, there was discussions in 2016, 2017, certainly in 2018 when I was running, about taking our universities and colleges and creating a pipeline program to completely expand our healthcare workforce, right? Our tech workforce that was specifically around cyber that would have been working at home. I mean, we still have that opportunity today where we can take this time, we can completely revamp what it is that Rhode Island specializes in terms of work, and in doing so, even create infrastructure that currently doesn't exist for healthcare to confront the next wave of the next thing healthcare related. And again, we're months into this. People are at home. Healthcare certification programs at CCRI do exist. And for some reason or other, we're not even taking steps to do that. So we've talked about the risk to in terms of lives. We talk about the crisis criteria. We've talked about capitalism and the challenges associated with it. But at the end of the day, right, like, what are we doing and why are we doing it, right? Because if all of our discussions here are for some end goal, from my perspective, to be very clear, my end goal is how do we put people in a position in life to have an opportunity to live a healthy life, to live a safe, a free life, and ultimately to participate in economic gains across the board, to participate in this economy. And unless we start thinking about that, I'm convinced that the fourth wave of this pandemic, which is purely going to be economic, right? The third wave will be when we start seeing the impact of those people that were sick and not taken care of because there was no room in the hospital, not the people with COVID-19, the ones that had heart disease. But that fourth wave is an economic one. And if we can't do anything to resolve the situation in the second wave, we can at least start planning out how to address the fourth wave. So that's my piece. And with that, I just want to hand this back. We'll go in a different order now. We'll go Scott, Pat, and then Bill. Just say whatever you want to say. Make sure you tell us what you're going to be doing over the next week as well. We'd love to hear it. And then we'll just go down the line.
All right, thanks for letting me lead off this time. I love the leadoff position. So next week on the Rotunda on 990 WBOB, I'll be talking some more about post-election coverage and the inability of the outgoing administration to, just kind of face facts that they lost the election, and just the worry that I have. And I know this is kind of off of the COVID tangent, but just the worry that I have for the overall weakening of our democracy that we've seen out of one administration in 4 years. And can we get back to, I think it's also kind of like a product of where we're at right now with the COVID deniers, if you will, everybody challenging facts that they don't agree with. I just want to see if we can get back on track with someone, with an adult in the room, if you will, in the White House. So, we're just going to see where that goes.
My turn? Okay, just quickly, because I was a hogger today. Sorry about that, guys. But number one, there's been a big move afoot, and Senator Lou DePalma was one of the champions to give more grants to business. I've got a solution here, and it's actually a lot simpler. How about taking away less at first, so you don't then, as I'll employ Mr. Rotondo's analogy, have to break their legs and then offer them a crutch. So take less and leave more in the hands of truly small independent businesses in Rhode Island, and stop patronizing them with this notion that you're the backbone while you take out onerous fees. The second thing I wanted to point out very quickly, I did a piece on the coalition. It's at coalitionradionetwork.com. You'll see me allude to it all over the Facebook. Tomorrow, the governor is going to be participating in a very special conference with the folks at salesforce.com. So exclusive that as a member of the general public, you can't sign up for it. Now, it's a sales conference. And ostensibly, when they responded to my inquiries, they said she's going to be talking about COVID-19. Now, I'm going to be asking tomorrow for a copy of the video, because I just don't see that when a sales conference is being set up to hawk a particular product, I just don't get it. And she's being announced, if you will, as a keynote speaker, as the governor of the state of Rhode Island. Now, I take offense at that title being used in relation to a private product. If she had said Gina Raimondo, leader / entrepreneurial space / investment banker, okay. she's certainly free to do what she wants, but she is using her title as a governor of the state of Rhode Island to engage in engage in commerce, if you will, at a time, by the way, when clearly within a day or so afterwards, we will be discussing again the morbidity rate of Rhode Islanders across the state, and we will be discussing again the potential meltdown, if you will, of this state medically. So I find that highly offensive. It's being the CEO of the company is a super donor politically. I have yet to find any donations taking place. I'm sure it's all thoroughly legal. Is it unethical? I don't know. Is it distasteful? Very. Thank you.
Thanks, Paul.
So this just came in on the Providence Business News right here. So those grants you had referenced, and you think about it, boy, what's your favorite deli? What's your favorite cafe? What's your favorite childcare service business? What's your favorite, any small business here in the state of Rhode Island? Here are the distribution of those grants. The zoo is going to get $350,000. They're going to do a drive-through holiday light show with that money.
Oh,
Federal Hill's going to get $350,000 for daytime holiday events between late November and mid-December, including a Santa Claus that didn't have a mask on that was in the middle of Federal Hill all last week. Trinity's going to get $175,000 to do a Christmas Carol online, which they were already doing. Something called the Talent Factory in NK, also $175,000 to do a pop-up theater. And this is the one that gets me. The Preservation Society of Newport County, they're going to get $74,650 to put on an outdoor holiday light show at the Breakers. So as businesses around the state are shutting their doors, entrepreneurs are being left years behind, okay? Musicians, artists, other design types are shifting from making art that contributes to society on a micro level to corporate desk jobs or service jobs so they can survive. These humongous institutions are receiving the largest portions of this grant program to do superficial things. And look, I actually have now recently come to the conclusion that zoos are unethical and animals should be not held in captivity. But I'd like the Roger Williams Zoo. I'd like to go see Franklin, the new anteater that was just birthed there. That's fine. But all of these things are totally unnecessary. This idea of holiday celebrations, you know what? I got a turkey flower here. You know what I mean? This is my Thanksgiving. Everybody buy one of these for $5 or whatever, or something like that. Put it in your window. Grow up. And this is the world that we live in right now, where this kind of nonsense is getting that kind of money when there are people also, today's December 1st. I know dozens of people personally that have not been able to get through to TDI or unemployment to get $116 so that they might have a chance at coming to some kind of agreement with their real estate landlord or mortgage operation. That is an absolute disgrace that those organizations were given that kind of money for superficial things. We've got people dying on the floor of the convention center right now. It's mind-boggling. So I'll just leave it right there.
Thanks, Bill. And just to put that in perspective, right? Jack Reed brought some money for community healthcare, and it totaled $750,000. And if that sounds like a lot, I'll tell you it's not. It's not for healthcare. It's some change. And Jack Reed has brought multiples of millions, right? I mean, tens of millions of dollars for Electric Boat and other companies. So, yes, there's a disconnect. And it's hard for me to shake the idea that it's not related to the fact that the communities that are suffering are the same communities that have been disenfranchised and disregarded for decades in this country. So with that, I want to end on a kind of a poetic thought that I had today. I kind of created a post on Facebook with it. It's really poetic. So for any of the not so lighthearted, we'll see you next week. But really, it's just a way to say, we're all in together. Here it goes. Love is light. Love and light find themselves equal. Within their nature, a common purpose, to distance us from dark places, to reflect onto our lives, and by virtue of their presence, to unveil the deepest of secrets, which is that our existence and all the facets that it embodies are tempered and measured by the very brilliance and warmth emanating from those very visible and invisible forces. This is a time for such forces. And to all of you today, I just will remind you all to be kind to yourself, Be kind to others. We are passionate. We will fight when we have to, but at the end of the day, let's not fight each other. All right. Thank you all. Hope you have a great evening. We'll see you next week here on Pump Up the Volume. Take care.